Hi, thanks for your interest today. My name is Rob Adsit, and I'm the Director of Education and Outreach Programs at the University of Wisconsin Center for Tobacco Research and Intervention. Today we're going to talk about nicotine dependence, the tobacco cessation coverage benefits in the Wisconsin Medicaid program, and an overview of the outreach program that is part of our center. First, I want to start with talking about dependence to nicotine. We know that tobacco dependence requires ongoing rather than acute care. It is a chronic disease. We also know that relapse is a component of the chronic nature of the disease, and relapse isn't an indication of personal failure by either the patient or the clinician. We know that nicotine dependence exhibits the classic characteristics of drug dependence. It causes physical dependence, and that includes withdrawal symptoms upon stopping. It interacts with and stimulates the brain, and it's tolerance producing, meaning you need an ever-increasing amount of the nicotine to satisfy the cravings for the nicotine. Cigarettes are an incredibly efficient nicotine delivery device. It takes only 7 seconds after you puff on a cigarette for the nicotine to reach the brain. We all have nicotine receptors in our brain. The picture on the left shows those nicotine receptors, and they're basically inactive until they're exposed to nicotine. And the picture on the right shows that not only do they activate, but they also multiply. And that's part of what leads to the cravings. Once they're exposed to nicotine, they want to be continued to be exposed to nicotine and to get nicotine. This is a short video that does a nice job of describing nicotine's effect on the human body.
Cigarette smoke contains more than 4,000 different chemicals, with nicotine being the primary component. Nicotine is a naturally occurring colorless liquid that comes from the tobacco plant. It is considered an addictive drug, making cigarette smoking the most prevalent form of nicotine addiction in the United States. Cigarette smoking is a cause of many preventable diseases worldwide. The effect nicotine has on the brain and the body is complex. With each cigarette, a smoker takes in approximately 1 to 2 milligrams of nicotine. The smoker immediately experiences a high after exposure to nicotine due to the drug's stimulation of the adrenal glands and resulting secretion of epinephrine, also known as adrenaline. The rush of adrenaline stimulates the body and causes an increase in blood pressure, respiration, and heart rate. Nicotine also causes the release of dopamine in the brain. Dopamine is a chemical responsible for sensations of pleasure. The release of dopamine causes the smoker to experience a sense of euphoria following nicotine exposure, similar to other psychoactive drugs. The feelings of a high and of euphoria enhance nicotine's addictive effect. Repeated exposure to nicotine results in the development of tolerance, the condition in which higher doses of a drug are required to produce the same stimulating effects. When an adequate level of nicotine is not maintained, the smoker will experience symptoms of nicotine withdrawal. These symptoms include decreased heart rate, difficulty concentrating, nervousness, headaches, increased appetite and weight gain, insomnia, irritability, and depression. While these symptoms will diminish over time, the adverse effects of nicotine withdrawal make it difficult for most people to quit smoking. However, there are many resources and techniques available to assist individuals who want to quit. Consult with your healthcare professional for information on these resources.
So as you can see from the video, nicotine has a complex and multivariate interaction within the human body. So let's talk next about how to treat tobacco use and dependence. 70% of smokers report that they want to quit. Almost 80% of smokers see a clinician each year. Unfortunately, only about a quarter of those seeing a clinician leave a visit with evidence-based counseling and/or medication. The good news is there's a deep body of evidence around what works to help nicotine and tobacco dependence. The picture here is of the clinical practice guideline called Treating Tobacco Use and Dependence, and it's over 8,000 research articles from 1975 through 2007 that were reviewed and analyzed and summarized to provide the state-of-the-art evidence that can guide clinical work. To see the entire clinical practice guideline, you can use the link at the bottom of the slide. Key findings from the guideline: brief clinician coaching and counseling is effective. There are currently 7 FDA-approved tobacco cessation medications. Counseling combined with medication is the most effective for quitting and staying quit. And finally, the guideline talks about health system level changes so that tobacco cessation treatment is integrated as the standard of care, so that each patient who comes to a healthcare visit that is a smoker receives some level of evidence-based cessation. Why should we treat nicotine and tobacco dependence? We know that it can improve not only the health of patients, individual patients, but in the long run it increases the health and improves the health across populations. We also know that nicotine dependence treatment is both cost-effective and clinically effective. Here's the brief intervention that the guideline talks about. It's called the 5 A's. It involves asking all patients about their tobacco use, advising all smokers to quit, assessing people's willingness to make a quit attempt, assisting the patients with quit attempts, and as I just mentioned, that should include both counseling and 1 or more of the 7 FDA-approved medications, and then following up with the patient to see how their quit attempt is going. Here are some really crucial elements, core components of a quit attempt. One is to set a quit date. You should enlist support of your family, friends, and coworkers by telling them you're going to make a quit attempt. You should prepare for challenges. We know that withdrawal symptoms, being around other smokers, and alcohol use can lead to relapse. In fact, 50% of people who relapse during a quit attempt have some alcohol in their system. And then the R of the STAR model is removing all the tobacco products and paraphernalia from your environment. Those are just triggers. Seeing those kinds of things are triggers that can make it difficult to stay quit. As I mentioned, there are currently 7 FDA-approved medications for tobacco dependence. 2 of them are non-nicotine, and they're both pill form. One of those is bupropion SR, sustained release, and the other is varenicline. The other 5 are all nicotine replacement therapies and come in various versions. The nicotine gum, inhaler, nasal spray, patch, and lozenge. We have a full medication chart, including dosing and contraindications, available on our website at the URL listed at the bottom of the slide. And we also keep that up to date with all of the information on each of the medications. We know that tobacco use causes a lot of illness. It directly causes 30% of all cancers, and that is also 90% of all lung cancer. Smoking causes about 30% of all cardiovascular diseases and 90% of all COPD. It also causes premature death. Over 400,000 deaths each year are attributable to smoking. In fact, that's 1 out of every 5 deaths in the United States. There are huge economic costs to tobacco use and nicotine addiction, including about $100 billion each year in added healthcare costs, another $100 billion each year in lost productivity. In fact, the average smoker costs about $1,600 per year in healthcare costs, more than an average non-smoker. The average smoker also takes 2 extra sick days per year, is 8% less productive, and spends about 30 minutes every work shift on smoking rituals. There's been a tremendous decline in tobacco use and dependence over the last decade, but some populations are being left behind, including people with the lowest income and fewest resources, people with the least education, people with comorbid mental illness or addictive disorders, and some racial and ethnic populations. The Wisconsin data that you're going to see on the next series of slides is all available on TOBWIS, so all of the tobacco prevention and control programs have access to this. I'm not going to spend a lot of time on these, but just to point out some of the disparities and discrepancies. In the United States, it's estimated there are a little over 8 million smokers who live below the poverty level. And you can see in Wisconsin in the box that Medicaid, Badger Care recipients smoke at a rate of about 32%, which is more than double the adult smoking rate in the general population. Again, across the U.S., there's over 22 million smokers with a high school education or less. And in Wisconsin, you can see that less than a high school diploma smoke at about 26%. There are an estimated just under 5 million alcohol-dependent smokers in the United States, and we know that they smoke at much higher rates, more than double, compared to the general population, general adult population. And we also know that people with substance use disorders who smoke are much more likely to die from their tobacco use than either their drug or alcohol addiction. There are over 9 million smokers in the United States with serious psychological distress. 1 in 5 adults, in fact, in the U.S. have some form of mental health issue. We know that smokers with mental illness, about 1 in 3 of smokers have a mental illness, and people with mental illness also smoke, are heavy smokers. Almost a third of all cigarettes in the United States are smoked by adults with mental illness. And finally, African Americans, again, in Wisconsin, smoke at more than double the rate of the general adult population. That's also higher than Wisconsin is also higher than the national average. And there's a disproportionate health burden of disease and death caused by this higher smoking. Native Americans in Wisconsin smoke again at more than double the adult general population smoking rate. And pregnant women, unfortunately, in Wisconsin smoke at a higher rate. 12% of women report that they were smoking during pregnancy, and that's compared to 8% across the United States. So what contributes to these inequities and these discrepancies and disparities? First is there's such a patchwork of insurance coverage. There are hundreds, thousands of different plans and benefit packages, and it's hard to decipher and clearly be able to delineate who has what kind of coverage for tobacco cessation and tobacco dependence treatment. There are some logistical barriers, not the least of which is access to health care. Many people in Wisconsin have to travel long distances to visit a healthcare provider or site. There's also what's called prior authorizations. An example of that would be a patient has to fail on a less expensive tobacco dependence treatment medication before they'll get coverage for a more expensive medication. We also know that counseling with medications, as I said earlier, is the most effective way for people to quit and to stay quit, but that is not the standard of care. It's not being delivered in the majority of healthcare settings. And then finally, a real challenge to effectively communicate with underserved tobacco users about what their benefits are, how do they access them, that kind of thing. Next, we want to talk about the Wisconsin Medicaid tobacco cessation coverage. I'm going to start with the counseling benefit and what Medicaid calls evaluation and management visits. They can be reimbursed even if the patient is there only for tobacco dependence treatment, and these visits do not require prior authorization. What is not covered by Wisconsin Medicaid in the counseling realm is group therapy, telephone, and web-based counseling. Also, counseling is not reimbursed for dentists or dental hygienists, although I want to point out that dentists can prescribe tobacco cessation meds. Regarding the medications, we're fortunate in Wisconsin that all 7 FDA-approved medications are covered by Wisconsin Medicaid. They all require a prescription, including over-the-counter medications, in order to be covered by Medicaid. And you can see the various medications there and whether they're over-the-counter or prescription. And I will point out again the URL for our full medication chart, which provides up-to-date full details about each of the medications. So for billing and reimbursement for tobacco cessation within the Wisconsin Medicaid program, the tobacco cessation treatment can be delivered by any Medicaid certified physician, nurse practitioner, or physician assistant. And services can be provided by ancillary staff, for example, a nurse. They have to be under the direct supervision of a physician, and the physician must be the one that bills Medicaid in order to be reimbursed. We have a variety of fact sheets on our website, one of which includes the details of the Wisconsin Medicaid called Badger Care tobacco cessation benefit package and details, and you can get directly to that specific fact sheet shown here by using the URL at the bottom of the slide. All right, I want to now talk about the outreach program that is part of our center. Our center was founded in 1992, and it is part of the School of Medicine and Public Health at the University of Wisconsin. And in 2000, our founder and current director, Dr. Michael Fiore, wanted to add translation of that research out into everyday clinical practice, and thus created the outreach program, which I'm going to talk about next. The primary funder of the UW-CTRI outreach program is the Wisconsin Department of Health Services Tobacco Prevention and Control Program. We have 4 staff who live and work in different regions of the state, 1 in Eau Claire, 1 in Oshkosh, 1 in Madison, and 1 staff person in Milwaukee. We've worked since the beginning of our program with over 500 primary care clinics, every healthcare system, almost all of the 17 federally qualified health centers, also called community health centers, and over half the hospitals in the state of Wisconsin. We work with clinics, hospitals, healthcare systems, dental practices, mental health and substance abuse organizations. We really focus our work on healthcare, both systems and clinicians, so that we can get the evidence-based tobacco dependence treatment that we know works and is effective into day-to-day clinical practice. We also have a free online CME, continuing medical education or continuing education credit, which over 5,000 clinicians have completed, and it's available again for free at the URL listed in the last bullet. Here's a map of our UW-CTRI outreach staff, including the counties that are part of their region and their full contact information. And again, this sheet is available on our website using the URL on the right. You can get directly to the map, and we keep that up to date and current. I want to talk now about a few of the strategies that our outreach staff use. The first is what we call academic detailing. Basically what that means is on-site tailored training and technical assistance. And more it's about the technical assistance, which focuses on the how to do this. Clinicians and systems ask us frequently about, okay, we understand the research, we understand the theory, but how do we do this with patients when they come in to see us? We focus our work a lot on changing the systems, the healthcare systems, to make that evidence-based cessation treatment intervention the standard of care. We use the 5A brief intervention model that I discussed earlier in the presentation, and a big part of what our outreach staff do is integrate the Wisconsin Tobacco Quit Line into healthcare systems and sites as a treatment extender. So it doesn't replace, the Quit Line doesn't replace what the clinicians do with their patients, but it extends that treatment that they can provide. Another strategy is partnerships. As you know, partnerships and collaborations are incredibly important. This is a list of some of the professional associations and organizations that we've worked with. And typically what we do is we provide the content expertise, and the association or organization then provides access to their members and promotion of tobacco cessation as an important area of work, and also the resources. So typically with associations or organizations, we develop a toolkit or a set of fact sheets. Often we write articles for websites or journals that they distribute to their members. It's been a really productive way to reach a lot of healthcare professionals across Wisconsin. How do we partner with coalitions and networks? We again manage the Wisconsin Tobacco Quit Line for the Tobacco Prevention and Control Program, and we have a lot of promotional materials that we can provide you to help promote the Wisconsin Tobacco Quit Line as a free resource. The regional outreach specialists can meet with multi-unit housing staff to talk about cessation and resources, including Wisconsin Tobacco Quit Line. Unfortunately, we don't have enough staff to attend health fairs and resident events. We get asked that fairly often, but we just don't have enough staff to be able to staff all of the events like that. And also, we've got really strong relationships, as I mentioned earlier, with every healthcare system in Wisconsin, and that includes Wisconsin Medicaid. Another strategy is our website. We have a tremendous amount of resources electronically available at the website, including toolkits, fact sheets. We present and record and post a lot of webinars, and we also have a number of videos. Here's our web address, ctri.wis.edu. The giant red arrow is pointing at the toolbar across the top, and that just helps direct people to resources related to who they are. You'll see researchers, smokers, Quitline, employers, providers, and policy resources. Here's what the provider landing page looks like. You can see there's a list of resources there, and then you can click on, like for example, the Contact Your Specialist takes you to the map so that you can quickly find who your outreach specialist is and what their email, phone number, and mailing address is, along with other resources for clinicians. Here's our fact sheet page, and the URL to get directly to this page is at the top of this slide. We have a long series of fact sheets, including, you'll see number 2 there, the medications chart, which I've referred to earlier. And number 3 is the Medicaid fact sheet, which I showed on a previous slide when we were talking about Wisconsin Medicaid. Videos are very popular on our website. Again, the URL at the top of the slide will take you right to our video page. We have a variety of videos. We've sorted them by topic. You'll see clinic, hospital, dental, pharmacy, that kind of thing. And that concludes the overview of the UW-CTRI outreach program. I end with my name and contact information along with our web address. Thank you.